Now, you walked in UK in 1992 and almost at the same time, and I kept on hearing about this gentleman called as Prokar Dasgupta from India when we hear something about neurourology. And I distinctly remember, you know, people said, I did my diploma urology there, I did my thesis there, and a lot of people said, have you met Prokar Dasgupta? He's a very exciting prospect. The day we had senior registrars meeting, I was a SR in Edinburgh Hospital, and I remember, still remember, it was one of the sort of trainees meeting in Peterborough, and you brought your wonderful work with the chilies, the capsaicin, and everybody was very much excited. And I just thought, here is a man who has very big potential, not only as a urologist, but he's going to make a big impression in research in neurourology and in due course of time when I heard about it. And can you tell us about that? Because I still have that sort of vivid memory with us. And you remember, Prokar, that time we didn't have slides. We just used to have an overhead projector and put it on the screen in Peterborough, one of these meetings, beautiful ones. So I was excited to see the chilies. And I also distinctly remember you showed how the chilies traveled, from sort of, all over the globe and came down to India or other way around. And it was
Correct.
Columbus who took the chilies to the Western world or other way around. I don't remember, but I distinctly remember you showing the overhead how the chilies had traveled across the globe. So, Prokar, just tell us and just educate us about your role as a researcher in capsaicin and how did it make a difference instead of neurogenic bladders.
So I was very lucky to have the Medical Research Council research fellow job with Professor Claire Fowler, who actually developed the first uroneurology department in the world. And this is the lady who was given a CBE now by the Queen, now emeritus professor. And the building you are showing is the famous National Hospital for Neurology and Neurosurgery, and the tall building, the skyscraper beside it, is the Institute of Neurology, the scientific arm of it. And this is easily UK's most famous neurological institute, if not one of the most famous in the world. So I managed to get in there at interview, and I think what had everything to do with it in my favor was the fact that I had already shown original scientific enterprise. And I remember Claire saying to me, much of this work will be counting nerve fibers under a microscope and image analysis. And when I said to her that I knew how to count lymphocytes and do image analysis, suddenly her eyes light up, because here's a surgeon who has actually spent time doing basic science in a lab. So she was treating these patients with resistant multiple sclerosis and other causes of neurogenic bladder with a semi-synthetic solution of capsaicin instilled into the bladder using a catheter. And that is where this capsaicin work comes from. And we already knew from the pioneering work of Chet de Groot that in spinalized cats, the afferent arm of the nerves from the bladder to the brain, which are normally A delta, become more driven by C fibers. And these C fibers are exquisitely sensitive to capsaicin. So C for C, capsaicin comes from chilies, and that's where this concept came from. And I noticed that if you look at the bladder biopsies in these patients, that there is a reduction and a downregulation in these nerves when you look at it under the microscope. And we then did some fabulous electron microscopy, again at the Institute of Neurology, looking at these tiny vesicles under the nerves in the lamina propria. So this was fascinating stuff. But of course, capsaicin was not licensed. So we then had a product called resiniferatoxin from the cactus euphorbium, which was much more potent than capsaicin to these C fibers, and was going to be available as a licensed product. So we were very excited. We became part of an international trial. And here is the first lesson you have to learn from research. When we started using resniferatoxin, we found that only the patients who were from Portugal in Francesco Cruz's arm of the trial, he's a famous neurologist in there, were responding to this treatment, but the others were not. So we had to break the blind code and see what was really going on and realize that apart from Cruz's center, the resniferatoxin was being supplied in plastic containers. So that was the same at Queen Square. And in his center, it was in glass bottles. So we realized that the resniferatoxin was sticking to the plastic container. So we were essentially giving the patients saline, except the Portuguese patients. The entire program just stopped. The company went bust. I don't think you have heard of resniferatoxin. So a bright drug discovery program from basic science to a wonderful treatment for patients just evaporated overnight. So that's what happens. So in research, sometimes you'll succeed, and some things that you will do as a first in man will just not work. You have to accept it and move on, which is exactly what we did.
Wonderful. Now, just takes you to your sort of a Dasgupta technique, which is a very popular technique. And can you just briefly tell us about, because we are talking of the same urology at this point, and just tell us about how did you think about it and how it became popular?
So we, based on the C5 story, kept looking for yet another treatment to reduce the overactivity of the bladder, not just for the neurogenic patients, but also for the bigger group, the idiopathic detrusor overactivity. And lo and behold, a paper came out from Brigitte Schurz from Switzerland, a pilot study of patients with spinal cord injury in the Journal of Urology, where she had injected botulinum toxin with a rigid telescope, and clearly with very good results. But at the time, we thought that trying to do this with a rigid scope under anesthetic, which is what they were doing, was perhaps not the right thing to do in these patients who have already advanced neurological disease. So Claire and I started thinking about whether this could be done as an outpatient procedure with a flexible telescope. Matt Harper was my research fellow at the time in Queen Square, and we started testing a special needle which Olympus was making, and putting this ultrafine needle, 27 gauge, putting it down the flexible scope. And we thought, can we pierce the wall of the bladder with this? I didn't think so. And we started doing this in oranges underwater, because I felt that the peel of the orange was about 4 millimeters thick, just like a bladder. And clearly the needle would not puncture it. So I think this is pointless. I also worried that this flexible needle would actually puncture the telescope. And lo and behold, 10,000 pounds of equipment would go down the drain. So people wouldn't be happy. So that is where the sheath came from. So the sheath first goes in, and then the needle clicks into it, that stabilizes it. So those were the early orange experiments underwater. And then I remember injecting this into a taxi driver from Luton. And I said to him, again, first in man, never done it before. I have no idea what I'm doing. And he said, look, I'm on my knees anyway. There's no solution to this. And then he responded. We did the first 10 patients, no failures. And then for nearly the first 100 patients, I was obviously very guarded, saying I don't know what's going to happen, and 90% success. And of course, now this is a 25-year story. So in 2006, I think Arun Sahai, who was my PhD student at the time, at Guy's, doing this in idiopathic bladders, the first randomized trial in idiopathic bladders, and then the licensing studies, subsequently licensed by NICE, by AUA, EAU, and worldwide licensing. So Arun was very much a part of it. And in 2006, he and Claire wrote an article naming it the Dasgupta technique. And Arun very kindly rang me to say, we want you to read the draft and want you to be named as an author. I said, I'm sorry, I've never had anything named after me. This is embarrassing. Please take my name off. So if you actually see the 2006 paper naming this, I am not an author, and I deliberately didn't want to be saying, beating my own drum. I just dislike that sort of activity. So that's what happened. And, it then got into textbooks like Smith's Endourology, and has now, I believe, become standard of care worldwide. So that's where the Dasgupta technique comes from. I didn't name it after myself, my colleagues did.
I think it's important two messages in that I can see. One is, I think you work very hard. Sometimes you get sort of defeated, especially you take the research up to a certain level, it cannot come to reality. And the second important lesson was the story you are telling me, that your colleagues, they should have such an open heart. And I think it's a wonderful gesture from their part that they wanted to sort of recognize your contribution. And I think it's a wonderful. Nowadays, you don't see these kind of virtues, but it's really, really sort of praiseworthy of Claire and your other colleagues at the Neurourology Center. Obviously, you did your FRC all important milestones. We all have gone through that, and I just did by 1998. And I think your research continued, you finished your rotation, and obviously you did your fellow European Board of Urology, which was very, very important, sort of a landmark, and anybody who wanted to pursue career in urology at that particular point. Now, having done that, just tell us, how did you sort of, proceeded with your career in Guy's Hospital, London?
So I was on the SR rotation from the Institute of Urology at the time, which you will remember was led by Professor Tony Mundy. Professor Mundy was a great supporter of mine, and he was based both at Guy's and at the Institute of Urology at the time, but subsequently moved completely to the Institute. So by the time I arrived in Guy's, Guy's had merged with St. Thomas's, and this is the late 90s, I think 1998, 99. So I arrived there, and the department had been merged by Richard Tiptoft, after whom our visiting professorship is named. Richard is one of my heroes, just like Claire Fowler is. And I was introduced for the first time to my other hero, Shamim Khan, now our professor of surgical education and a family friend, someone who I can go to whenever I am in trouble. And I can tell you, I'm still in trouble sometimes. So that's how it happened. I did my last few years of training at Guy's, a famous surgical hospital, clearly, with people like Ashley Cooper as some of the famous names. In fact, Ashley Cooper is buried in Guy's Chapel. So, then when the time came, I was being headhunted by a number of different centers for senior lectureships, because I had by this time managed to have a reputation as a surgeon scientist. So yes, people thought I was a decent surgeon, but they also thought I was a decent scientist. And so I was being headhunted, and Richard actually said, you must go and see these different jobs. What I didn't realize is all along him thinking that there's a job for him here. And this is almost reverse politics, So I only realized it subsequently, whereby seeing these other jobs made me realize that I'm already established here, and I don't have to go away and start from scratch 5 years later. I already had everything I needed in Guy's, and that's how the academic department started. And I have been there since even now, nearly 23 years. So I'm very much a Guy's man, and I'm really a proud Guy's man. The other little hook which Richard brought in was he contacted Claire saying, we are going to make sure that Prokar has Tuesdays free, no commitments at this end. Do you think he could go back to you and your lab and have a number of PhD students there, because otherwise we can't keep him engaged. So that's what happened. I used to spend Tuesdays in Queen's Square. We looked at the science behind botulinum toxin, various receptors, TRPV1 and P2X3. Wonderful, wonderful journey. Many PhD students, and that was a fabulous time.